Now we are talking about the so-called popliteal fossa, which is basically a space which is diamond shaped. Okay, so this index finger of the left hand is with the biceps femoris. We have identified this particular muscle as the biceps femoris. Then medially, this middle finger is standing on this particular muscle is the semitendinosus. Underneath it, we know this is the semimembranosus. So these are the upper two boundaries. So this is the superolateral, this is the superomedial. If we go inferiorly, medially, and sorry, this is the medial aspect, this is the lateral aspect. So medially we have got the medial head of the gastrocnemius, whereas laterally we have got the lateral head of gastrocnemius, and just underneath it we get a very beautiful tendinous structure which we refer to as the plantaris. So here goes the plantaris. Okay. So for all purposes, remember that the lower part of the popliteal fossa, inferolaterally, we have got the lateral head of the gastrocnemius, and inferomedially we have got the medial head of the gastrocnemius. When we are in the popliteal fossa, what we also find is, just by separating the structures a bit, we find that our sciatic nerve is getting divided. So this is the sciatic nerve, and it has got divided into a laterally going branch which we refer to as the common peroneal. This will go along the neck of the fibula, where it will again divide, one going to the anterior extensor compartment, that is the deep peroneal, and another remaining into the lateral compartment supplying the peroneus longus and the brevis as the superficial peroneal. And here it gives its next branch or the next continuation. This is the tibial nerve. So this particular nerve will eventually go into the posterior crural compartment. Then here we find the continuation of our popliteal vein, which is basically coming from downwards. And then we have got definitely the popliteal artery, which will now come here and divide into, or rather continue primarily as the artery of the posterior crural region, that is the posterior tibial, and a very small or a much lesser dimensional branch will go anterior to the interosseous membrane as the anterior tibial. We cannot see it from this side, but we can definitely appreciate the posterior tibial vessels, which we will see with relation to the posterior crural region. So that's about the popliteal region or the popliteal fossa. Definitely you will know the boundary and you will know the contents and the surfaces.